Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Abdulaziz Alsaadi. Today I will talk about the biological effect of MRI. Agenda. First, I will talk about the introduction. What is the MRI? Basic principles of MRI, MRI biological effects, and conclusion. Regarding biological effects, the first thing to note about magnetic resonance imaging (MRI) is the lack of ionizing radiation during a normal magnetic resonance (MR) scan. The patient body absorbs energy, however, the absorbed energy is the radio frequency per ton of body tissues, gases heating but not ionizing. In addition to mild heating, there are other biological effects that may result during MRI. Some of these are radiation inquiry, just as audible noise, other occur vary in frequency, just as RF burns, also at external rate, improper MR producer protector have results surgery energy or death. In general, MRI is safe and impact absolutely non-ionizing radiation does. In order to appreciate the range potential biological effect of MRI, it is necessary to first become familiar with the basic components of an MRI scan. What is MRI? Magnetic resonance imaging. MRI is a medical imaging technique used radially to form picture of anatomy and the surgical process of the body. Scanner use strong magnetic fields, magnetic field gradients, and radio waves generate images of organs in the body. MRI does not involve X-rays or the use of noise rotation, which distinguishes it is from CT and PET scanner. MRI is medical medical application of electromagnetic resonance, which can be used for imaging in other MR applications such as MR surgery. Basic of principle of MRI: the ability non-invisibly image the body by MRI is placed on the manipulation and dissection of the magnetic properties hydrogen nuclei. Hydrogen is the most abundant element in the body, and the hydrogen nuclei has magnetic moment with magnetic behavior similar to the electron, or conventionally the electron is spin half particular, meaning that it is absorbed as one of two states, referred to up and down. Similarly, the spin of the hydrogen nuclei is same either up or down. Rotation with respect and externally applied magnetic field. To summarize, MRI analyzes three main hardware components. First, the main magnets. Second, the RF coil. Third, the grating coil set. Biological effects. Magnetic resonance imaging. Considering a safe technology since it just has ability to change the position of atoms, but not to alter their structure, composition, and properties. as the ionizing radiation attempts to do. However, as any accelerated intervention, there are intrinsic hazards that must be understood, acknowledged, and taken into considering. These hazards are relative to all three types of fields which can affect patient and staff and other person with MRI environment. The potential danger biological effect assisted with MRI environment and procedure. Several studies have been conducted over the past 30 years, often producing controversial results. These studies are related to the biological effects of particular electromagnetic source, such as an MRI, while there is a lack of knowledge about a combination of the three magnetic force combinations. There is need to integrate the current finding to better understanding the structure between EMF and related to MRI and the biological system. Is divided three sections according to the three source EMF, which is an MRI producer. Is each section the risk assessment related to each field component segments. We focus only minimal human biological system for their opposite strict currently with the human health. I'll note to the biological effect magnetic resonance imaging are and that its safe technology has the ability to change the position of atoms but not to change their structure, composition and pressure. Thank you for listening.